Once we've diagnosed with polycystic kidney disease, the way that we end up deciding what to do next is based on an MRI of their kidneys. The MRI looks at the total kidney volume. So based on the imaging, we can help then select which patients might be a better candidate for the vasopressin 2 receptor antagonists. Vasopressin, which is a hormone that your brain secretes, is thought to be in very high levels in polycystic kidney disease patients. And it's thought that the vasopressin actually helps prompt these cysts to form. Reducing the vasopressin can actually help with reducing the cyst volume, and that's why ultimately these patients are put on these medications. The size of the kidneys has been correlated with trajectory of kidney function. The larger the kidneys, the steeper the decline in chronic kidney disease. Ultimately, when it comes to plotting the patients and their kidney function, we can divide them into different risk categories. Patients who are projected to need dialysis by their 60s, or even before that, these patients may be a good, kind of the ideal candidate for these medications. The V2R receptor antagonists, they are known to actually cause liver toxicity. The risk of having the liver disease or liver toxicities from the V2R receptor antagonists is very low. And we are very vigilant about checking this every month to make sure that there's no changes in the liver function tests. But ultimately, if these liver tests are kind of 10 times the normal for that patient, then it may not be safe to give them the medication. For patients who do have chronic liver disease or may have cirrhosis, being on the V2R receptor antagonists may not be safe for you. I think we would need to have a thorough evaluation of your liver and maybe even for you to see a hepatologist to help decide whether this is a good strategy for your treatment. Patients who are on this class of medications end up having very routine lab work. We don't want the kidney function to decline by more than like 5% per year, hopefully even less than that with the medications. The hope is, again, that the cystic growth stabilizes and the kidney function stabilizes.